एंड रिमेनिंग में हमारे साथ को मैं छोड़ देता हूँ. आई लीव इट टू डॉक्टर साहब. A little knowledge what I had. Thank you very much. Thank you for kind invitation.
या बहुत शुक्रिया सर आपका. बहुत ही इंफॉर्मेशन शॉर्ट पीरियड में आपने दिया. सर इज़ इनिशिएटेड टू दिस इज़ इन फैक्ट इज़ द मेटाबॉलिक डिसऑर्डर and it is the metabolic disorder is indicating digestive related disorders. You just minimize that, what exactly sound, and also what the balanced diet to be taken that initiated. So by using the protein, fat and carbs all together, how need to be moderately to be taken place. But however fatty oils or the junk food or all the oily spicy food is not advisable. By the way, the salt, sugar, maida, besan, atta is not advisable. Mangoes can be taken as sir told that yes, obviously now is the season, can be taken the mangoes by the diabetes patient. Make sure the patients who have the kidney related disorders or the renal impairment they do have, for them it's advisable since it is having the more potassium in the mangoes. That's the reason for the kidney patients are not advisable, but diabetes patients obviously they can take, as Dr. Ishwar said, 1 or 2 can be taken, but every day 1 mango is taking, that will not harm to the body. But make sure that is good ripe mangoes is good. Along with that is the apple, orange, jamun, guava, watermelon also advisable. And vigorously every day it's advisable to have the exercises minimum 30 minutes in the morning and evening 30 minutes or maximum 45 minutes would be really grateful. And diabetes food we should take care of that. If that will going to damage, again there is some kind of the gases, gangrene or the some other gangrene which causes the much more problems. Along with that his experience, he said that okay, what are the points to be activated, as rightly said. I do agree, Dr. Ishwar, you told me is 2 points you told me, so that is many points. But along with that, so liver 13 is the Changmen, which is at the end of the 11th rib, the point is located, which is connecting to the move frontal arm point for the spleen and then pancreas. If you use the liver 13 on the right side, that's useful for the pancreas. If you just use it on the right side for the pancreas, left side you are using the same point, would be useful for to treat for the spleen as well. And along with that, liver 3 point is really great point since it is the source point. Liver is the major role to converting the glucose carbohydrate to glucose level, and also it synthesizes lot of enzymes which is required for the metabolism as well. That we will going to see step by step. Along with that, stomach 36, Li11, Ren 12, and also embedding therapy or the implantation therapy also good to apply some of the needles where exactly we need to do the implantation of the needles, and some of the points I would like to say. बहुत शुक्रिया डॉक्टर साहब. नाउ वी विल प्रोसीड फॉर द स्टेप बाय स्टेप. या शुक्रिया सर. थैंक यू सर. थैंक यू. सो अभी हम लोग स्वीट के बारे में बात करेंगे. जो स्वीट हनी है, हनी इज़ everybody like the honey, and sweet is everybody like, and you can check with the phones and they will going to save the numbers in the sweet honey, or maybe honey or the sweetie, or maybe some kind of the sweet love, something they will use to save the numbers, because they are only one who are very connected, heart is connected, that is the sweet honey. But here his sweet honey is the mellitus. Perhaps we may check who is your mellitus, then we will come to know that who is very great. But after the marriage only this mellitus is good or bad will come to know. In that way, the after coming to the mellitus to the body only come to know whether it is sweet or bad in the later future. But however, we try to understand the Greek word, the diabetes they use as a Greek word, that to be known as the excessive. There are the 3 X. Excessive, 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 keep it in the mind. That is the major indication in order to understand the diabetes mellitus. Number 1, excessive to be known as a, as rightly said Ishwar sir also, one is excessiveness, is the polyuria, polyphagia, polydipsia. There are the 3 different concepts where generally we'll get the problem. PPP, poly. Now what is the polyphagia? Polyphagia is indicating the excessive hunger. So this morning I told you what could be the reason to cause the excessive hunger. So which tapeworms are the reason to cause the excessive hungry. In that way, diabetes mellitus also another reason to cause the excessive hungry, that to be known as a polyphagia. Then excessive thirst is the polydipsia. So excessive thirst in indicating very oftenly we need to drink the water, and most of the times the tongue will be trembling and also thirsty and will become the dry. That also another indication. The third indication is polyuria. So that means is the oftenly passing the urine, especially in the night time. In the liver time, they oftenly go for the urine in the night time. These are the three different excessiveness to understand about these are the sign and symptoms of the diabetes. And then mellitus, the word is coming from the Latin word, again it is sweet honey. So a condition where the sweet tasting urine passing through. But there is a history when ancient people diagnosed that urine is normally say as a chiaoke or chiaoka. The pronunciation is different, but the real pronunciation is xiaoka, also can pronounce. But in this particular time, the people will recognize that the imagination and thirst, so could be reason to cause this diabetes mellitus. The person will become is the 70 kgs, suddenly he'll come in the 3 months period, he'll become the 60 kgs. Then we recognize it is the hyperthyroidism, or perhaps it is the diabetes mellitus. In the two conditions, normally the person, the weight drastically will come down, and also thirst. So there is a Chiao is Xiao to be known as imagination and third, and the Ka in Chinese medicine, that also to be known as a thirst. So how the Chiao Shenpa, that means normally is the Chenchu, acupuncture, moxibustion, like that, but this also is the two different words, but together to become as a diabetes mellitus is the sugar related problem normally we can consider. That's called as a Xiaoke. But in the ancient time we recognize when we pass the urine, especially the ancient people, they pass the urine, that time but after passing the urine, later period, in some period of time, and immediately will going to circulate and then will attack to that urine by the ants. So ants will cover on that region. That time they recognize what could be the reason. Normally sweet is there, so you put it sweet somewhere else on the floor, and then after some time the ants will come and then cover to eat that. But in the urine also in that way is happening. What could be the reason? So that time, yeah, they recognize there is a urine sugar is excessiveness in the urine could be the reason to cause this problem. In that way they recognize and understand, yes, this is as a diabetes mellitus. In that way they understand about the what exactly we call as a diabetes mellitus has been founded by the ancient people. That Chinese people told that is the Xiaoka. Xiaoka, perhaps this also one question in your examination, objective types, you need how to understand about the Xiaoka, or maybe is the another names is the Siawan, Suwan, Tu, Weng, Tu, Weitung, something we ask the four objective types. In that, what is the diabetes called in the Chinese names? So that time you should know what exactly is it. No, not required all the time. Perhaps in the 5 marks, maybe out of 70 marks, we may ask you 5 to 10 questions, 10 marks at least related to the pin-in names. So which is day-to-day clinical practice, we use it. Only that all 400 points may not be required to keep it in your mind, which is not essentially required. In that way you just keep it in the mind. Now coming to the stepping into the pancreas. So we do have the certain glands. How many glands we do have? Totally 7 glands we do have. One is the pituitary gland, the other one is the pineal gland, thyroid gland, and then adrenal gland. Further is the testicles and ovaries and pancreas. So these are the overall 7 glands we do have. In that there is a small gland is existing. Pancreas of course is the big gland. In that around there are the cells existing. That cells to be known as a islets of the Langerhans are existing. In that the entire pathway of the pancreas, what is existing, there is some kind of the production of the insulin is there. So there are the two kinds of the hormones are producing. One hormone is produced by the pancreas, number one to be known as a insulin, the second to be known as a glucagon. Right, these are the two hormones are produced by the endocrine system of the pancreas. Exocrine function, so provide the digestive enzymes that break down the carbohydrates, fats and proteins in the small intestine. The pancreas plays the role in maintaining the blood glucose balance and supporting the digestion. So whatever it produces, enzymes produces in the gastric juices and also pancreatic juice and intestinal juice. So whatever enzymes are required to do the metabolism and the digestion, that to be directly pouring into the system itself, the pancreatic juice, something like that. Whereas in the endocrine glands, the saliva is exocrine gland. Right, whereas in endocrine gland is indicating whatever there is the hormone is required, that hormone is directly releasing in the bloodstream. That is the beauty of the endocrine gland. That's the reason today there is a doctor called as a endocrinologist. That means only he will going to see the 7 glands, but in that thyroid gland, pituitary gland, something like that, only he will focus on the endocrine glands. So there is only the 7 glands will become the one doctor. Then you understand how so crucial and important to keep it all the information in our mind to treat the people. Now let me see, there is the in this gland insulin, the major function. How much insulin will going to produce and what level of the insulin is required in our body, from where it origins. Normally you recognize the entire pancreas region, only the 1 gram level of the gland is existing, insulin production to be taken place. So only that particular 1 gram region is there. From there it produces the insulin, the other one is produces the glucagon. How crucial you will going to see in the pancreas. So that God has been kept in that inside of the pancreas, only the very micro level part to produce the insulin. So that insulin is taking care from the birth to till death, it taking care for the entire metabolism and also to taking care for the diabetes mellitus in our body. So now let me see insulin and glucagon. There are God has been created something. We are really thankful to him, because one is the agonist and antagonist, how we can say. One is the active, the other one is inactive. One is the passive and then active. In that way this will going to work in the body. So insulin, it lowers the blood sugar level, right? Whenever the insulin get excessiveness, so that time what will happen, insulin is required to do the monitoration, to regulate the body system. For instance, when the diabetes patient, non-diabetes patient, you know, whatever you sweet and mangoes you eat, but the sugar will not elevate. But the diabetes patient, they take the mangoes, maybe timely it get changes, again it will get the control. But need not to worry about it. Mangoes are good one or other way to get the diabetes also gets control. But as rightly Ishwar sir said, one, you just take it every day, but that will not. Maximum 2 can be taken, but not more than that. So in that way, if the non-diabetes patient, but they sit in front of the good mangoes, most probably Mallika mango is the really very, very delicious, and Malhoba is the very delicious, Badami is the very delicious, you know, right. So if you keep it maybe 2-3 different types, and that, so one is completed, the other you wanted to eat, the other one is more better than that taste is Malhoba. So likewise we like to have it, but that will not shoots up the sugar level. But in that case, body is regulating that glucose level precisely good when the person doesn't have the diabetes mellitus. So in that case, when the insulin is monitoring and regulating that, when the insulin level is, so once it will not produce enough insulin to regulate the body system, that time the insulin, it will not sugar level bring down in the normal level. In that case, what happen, the glucose level will going to increase in the blood, which causes the excessive sugar level in the blood system, right? That is a good glucose and then bad glucose. There are the two types of the glucose. Again, the good glucose need to be monitored and to be regulated. The bad glucose enter into the blood, that increases the sugar level. But at the same time, what we eat mangoes for the non-diabetes patient, that to be known as a good glucose itself. The good glucose mixed with the blood, that will not harm to the body. But already diabetes patient, the blood is sweet is there, that's called as a mellitus. Already sweet is there, that causes further more problem. In that way we try to understand. Now the glucagon, something is different. The glucagon to be known as how God is created. But normally you recognize there is the two types of the diabetes problem. One is the hyperglycemia, the other one is the hypoglycemia. When the hyperglycemia is there, that particular time the insulin production will bring down to the Baba. You should not increase greater than 200 mg per deciliter in the blood is not advisable. Then this insulin production, insulin will bring down to the normal level. When the person will get the hypoglycemia, timely will get, for example, now it's the time to have the lunch by 2 o'clock or 3 o'clock. Within that you need to take up. But when you have not given the glucose to the body system, that time the hypoglycemia chances are there. Then what was the normal range? It goes to the 70, 60, 50, something like that. But the person glucose, it's nothing but is the kind of the original energy. That's called in normally says as the chi in the Chinese language. In that way, in the glucose is nothing but is the energy. When that energy is diminishes in the body system, that obviously having the problem. In that time hypoglycemia it causes. That time God created a hormone, that hormone to be known as a glucagon. So glucagon, it increases the level of the index level of the diabetes. Then that should come to the 100. So 100 is there, that absolutely normal. But later period I'll try to tell you what are the normal range of the diabetes. When we'll say is the hyperglycemia, when we say as the hypoglycemia, let me see. But however, the insulin and glucagon, there are the two hormones are produced by the beta cells of the Langerhans of the pancreas. One to be known as insulin, the second to be known as a glucagon. There is a alpha, beta, what we call as a beta Langerhans and alpha Langerhans. There are the two different hormones are there, but two different cells that will going to produce these two hormones in our blood. So now exocrine, as I told you, they produces the enzymes like amylase, lipase and protease. What is the major function of the amylase? Amylase is very much essential whatever you eat. So like normally we take in the Indian culture, especially South India people, normally take rice is the main food for them. Right, rice we need to take it. Morning, if you give them morning, afternoon, night, 3 times also rice, they're happy to take. But they wanted to take chapati, they says okay, with great difficulty they take one chapati. Millets is forgotten. All the people, I think the ancient people, they used to take the millets. But these days, people feel that is not really good. But how the ragi balls, also one kind of the little millet. But little millet, you just ask to the Ishwar sir, you ask to the Deve Gowda ji, you ask to the ancient people, Gowdas, then how beauty of that the ragi balls. Even today ragi balls people are using. I hope so. That is really important to regulate the friendly of the diabetes mellitus as well. By the way, 7 different types of the millets, Sri Dhanya Galu. So all are really good if you take it at least one Sri Dhanya every day. That always is good. It's the fiber is get excessiveness, metabolism also good, digestion also its possibilities are good. Further, it controls the diabetes mellitus indirectly. But it at the same time carbohydrates, it having some kind of the amylase. Amylase is kind of the enzyme which is very much essential for the carbohydrate metabolism, and the lipase is very much essential. Lipids convert in the form of the fatty acids, but lipase is the enzyme where it converts the ADEK. There is the fat soluble vitamins that will be digested by the lipase, and protease normally we try to take as a protein. Proteins are again two types. One is the animal protein, the second is the plant-based protein as well. And the people who are the non-vegetarian people, they consume the lot of protein as well. Like you can take it as a paneer also kind of the protein. So likewise is the yogurt, and also the milk and dairy products also good in source of the protein, and also all the sprouts. Yeah, pulses, sprouts also really good for the proteins. In order to improve the muscle strength, normally they take it. The aids in the digesting of the food in the small intestine. All the things to be taken place in which small intestine. Remember, the pancreas, normally I am talking here is the insulin and glucagon. No doubt that production is good in the hormones, but each and every abdominal system, the alimentary system are the reason to cause the diabetes mellitus. The problem is not the pancreas, the problem is in the oral cavity, the problem is in the mouth system. That's the reason now mouth are the reason to cause the diabetes, lips are the reason to cause the diabetes mellitus, teeth are the reason to cause the diabetes mellitus, salivary glands are the reason to cause the diabetes mellitus, esophagus is the reason to cause the diabetes mellitus, stomach are the reason to cause the diabetes, spleen are the reason to cause the diabetes, isn't it? At the same time, intestine also reason to cause the diabetes, gallbladder are the reason to cause the diabetes, liver also reason to cause the diabetes mellitus, kidney are the reason to cause the diabetes mellitus. Majorly there is a kidney system, and however the brain also reason to cause the diabetes mellitus, and people will say only the pancreas is affected, that could be the reason. But however, I can give you the interconnectivity from the baseline to the top level, how all these organs are impacted to cause the diabetes mellitus. That's the reason when you are treating, remember is the fan, F-A-N. Yes, fans. Fans, you remember, F is belongs to the fat related conditions, and A is belongs to the, you remember A is something connected to that, or N is nutritional value, and further is the S related to the stress level. So all are very much essential to regulate our body system. So in that way, I can connect to each and everything, how is connected. Now I told you small intestine, all the metabolism to be taken place is small intestine. When the small intestine metabolism, protein is not converted to the amino acids, when the carbs is not converted to the glucose totally, or the amino acids are we called as a proteins and then carbs and then protein, carbs and then fats. So these are not converted in the small intestine. Then small intestine also reason to cause the problem. When the food is not breakdown in the stomach region is the reason to cause the diabetes mellitus. When the spleen is the reason, when the nutritional value is, yes, N is belongs to the nutrition value, that will not do the transformation in the body. That also could be the reason to cause the diabetes mellitus. Pancreas, I told you, that is the insulin production. Likewise, every organ is internally connected. When the person gets the polyuria, when the person will get the polythirst, and excessive yang is excessiveness in the body, yin is deficiency in the body, kidney yin is deficiency, and then yang is excessiveness is the root cause for the diabetes mellitus, for the shoka. So that's the reason polyuria you are getting. Why do you get the polyuria? So yin is deficiency, yang is excessiveness. Yin get excessiveness in the night time, yin is very very low. That's the reason he goes 2 times, 3 times, 4 times in the night time. So hopefully kidneys, that's the reason all the kidney related patients, normally they do have the erectile dysfunction, or maybe some kind of the, the erectile dysfunction. Apart from that is the male related sexual activities cannot be done, premature ejaculation conditions they do have. So what could be the reason? Kidney is impacted. Kidney, when the major renal artery supplies to that, when the renal artery, when the blood is mixed with the sweet urine or is sweet, so that connecting to the renal artery, when the renal artery mixed and the sweet is mixed with the renal artery, that passing to the kidney, also reason to cause the kidney failure. Today the renal impairment people are happening. The reason is because of the artery also involving for the excessive sweet in that region to cause that kind of the problem. Hopefully beta cells lower blood sugar level after eating, release after eating when the blood sugar is high, storage the excess glucose is the glycogen in the liver and then muscles. Of course, the glucose is converted in the form of the carbohydrates convert in the form of the glucose, then glucose is giving to the blood region. From the blood it goes excessive when the glucose level is secretion to be taken place with the food, then ultimately we are going to stay on which place? Where we are going to store? Liver, good. So liver it going to store, then the glucose, whenever we require the glucose, then it will convert in the form of the glycogen. It stores as a glycogen, it convert in the form of the glucose by the liver whenever we require the energy. That's the reason liver is the major role. Liver is the reason to cause the diabetes mellitus, isn't it? Now let me see alpha cells and then beta cells. So alpha cells, in the pancreas it produces the glucagon. Glucagon produces by the which cell? Beta cell or the alpha cell? Alpha cells produces the pancreas. They rises the blood sugar by releasing the storage glucose from the liver. Release it when sugar is too low. So whenever there is, that's the reason, remember, whenever there is a hypoglycemia or the hyperglycemia, there are the two concepts. So whenever there is a diabetes patient, sometimes he'll get the perspiration is sweating and also there is a loss of unconsciousness. He'll get the unconsciousness. Remember, in the hyperglycemia, normally rare chances are there to get the unconsciousness. Only he will get the unconsciousness, loss of consciousness with the hypoglycemia. The glucagon level having the problem. In that case, you remember the sugar level is dropped to the perhaps is the less than 40 and 30, something like that could be the reason where the unconsciousness is there. That's the reason always to improve the glucagon, what is required, the sugar is required. One tofu or the one chocolate or the one dark chocolate or the one dairy milk, anything you just keep it in your packet. Always it's advisable in the respective kit of the female or the male. Whatever bag do you have, always you just carry when you go outside. So you hope you recognize that whenever there is a unconsciousness of the patient, that time don't give the treatment to give the medicine or the insulin. Sometimes we are imagination. Some practitioners, they think that, oh, glucose is excess, perhaps that could be the reason. Put the insulin. I think at the home it causes the problem. Normally they don't have the idea about that. Perhaps increased my glucose level. That's the reason, oh, unconscious. Suddenly you just give the insulin. If the insulin, they are taking the type 1 diabetes mellitus, that could be the very serious reason. On the spot the person will going to die. That's the reason we shouldn't give the insulin injections. That is also there is a type 1, type 2 diabetes mellitus. We'll come to know what exactly. So in that case you recognize that, especially whenever there is the unconsciousness, immediately try to check the blood sugar. Again, checking the blood sugar also two types. One to be known as how to diagnose that. I think I'll try to tell you what is the capillary blood sugar test, what is the venous blood sugar test, what is the HbA1c, what is the fasting blood sugar, what is the postprandial blood sugar, which is the ideal one to do the diagnosis. That whenever that slide comes, I'll try to explain you that. But there is a one now, which now is controls the diabetes mellitus. Especially I love this to say, one is a splanchnic now. This morning also I told you, the now which is controlling and regulating to the pancreas. One to be known as rightly Ishwar sir told me is the vagus now, also very important. One of the longest now to be known as a vagus now. It starts from this 10th now of the cranial now. It reaching to the anal region, mesenteric region, till the intestine it reaches. In that way it is giving to the chest region, heart and then lungs and then stomach, spleen and pancreas and then till the lower region, intestine level, it's reaching the vagus now. That's also very important. Along with that, I would like to say another nerve to be known as a splanchnic nerve, splanchic, splanchnic. NIC, splanchnic nerve is the very, very crucial to regulate that. So normally here I need to say, why normally says Dr. Woltz told me that you need to use and focus only on the right side. They told me apply the needle. Right side is spleen meridian to be known as a pancreas meridian. Left side is spleen meridian to be known as a spleen meridian itself. Isn't it? Spleen is the lymphatic system, lymphatic gland again. But pancreas is again it is the endocrine gland. But endocrine gland is located on the right side but not totally on the left side. Don't ask me the question, but perhaps on the ear level we normally apply the pancreas point on the left ear but not on the right ear. Right ear we apply the gallbladder on the same place, but pancreas are applied on the left ear. No doubt on it. You just use it as a Paul Nogier who invented in 1959, but he told that left side pancreas would be more better than the right side, but we follow the same. But scientifically if you wanted to know, we will come to know that right side of the splanchnic nerve, no doubt there is a bilaterally symmetrical way the nervous system is passing, but however scientifically we wanted to know that time on the right side, especially on the T8th nerve. Remember and keep it in your mind. But the T8th nerve, thoracic 8th nerve, 0.5 tune lateral to the lower border of the spinous process of the 8th thoracic vertebra. Beneath of that, beside of that, that nerve to be known as a splanchnic nerve, that passing directly reaching to the pancreas through this dermatome, and that's the reason here I have mentioned as a dermatome myotome chart. But through that, whenever you wanted to treat the diabetes patient, that time focus as this one particular point. But wherever is the insulin point also we can consider in the Chinese terminology, we say as a insulin backshoe point is existing, that Wei Kuan Xia Shu. So Wei Kuan Xia Shu. So now that point is located 1.5 tune lateral to the lower border of the spinous process of the 8th thoracic vertebra, that point to be known as the insulin point. So where exactly that also correlating to this splanchnic nerve, that directly giving the impact. Rather than using on the left side, it's advisable to use it on the right side is advisable, because that one particular nerve is passing and reaching to that pancreas directly. But whereas in that other side it goes to the spleen, but this side it's going, right side is going to the pancreas, left side it's going to the spleen. That is the major difference. To recognize this concept, it takes me decades. It's not super simple. You people are really fortunate that I am giving you how the Ishwar sir told me. I am giving you the scientific presentation, but this is something is scientifically I am giving you this information. But in the Chinese terminology books, or maybe Chinese medicine and other modern medicine, hardly we will going to find this kind of the concept. Hopefully you can understand and keep it in the mind.